It's time for Business Talk here on Lenz on Business, presented by Lenz, Atlanta's marketing expert since 1992. Today in the studio, we have Marietta Plastic Surgery's latest surgeon that joined the team, and that's Dr. Biswas. Welcome to Lenz on Business, Dr. Biswas.
Well, thank you for having me. Appreciate
Absolutely. And you've been with the team for how long?
For about 10 months now.
Okay, so tell us, what made you want to become a plastic surgeon?
Yeah, so that's always a very multifaceted question because it's always a journey when you start with medical school and going down that path. And the way that it worked for me was that at first I knew that I kind of wanted to do surgery because I like to do a lot of things with my hands. Mm-hmm. And so I knew it was going to be some kind of surgery, but I didn't really know what type of surgery. And at the time when I was in medical school, I figured general surgery would be the most general way to kind of maybe know whether or not, there's going to be some kind of subspecialization that's going to be involved later on. But the thing is that as I kind of went through general surgery, really when I started kind of working with a plastic surgeon or did a rotation with a plastic surgeon, I really had zero kind of knowledge about what they really did. Mm-hmm. But when I got into that rotation and saw what they really did, I thought it was very fascinating. And it was way more fascinating, at least for me, compared to what I was doing with general surgery.
Right.
And that's when I kind of really was like, I think I really want to maybe do this. And so in my third year, that's kind of when I made the decision to undergo, or at least pursue plastic surgery. And plastic surgery historically has been a very competitive specialty to get into. And rightfully so, because out of all the surgical specialties, it does have a lot of perks that come with it, a better work-life balance, and that's really kind of the main thing. But for all practical purposes, it is a more fascinating field, at least for us plastic surgery, because I'm obviously biased, but we work from head to toe. That's one of that's one of the main things, whereas in other types of specialties, you're very compartmentalized into maybe one organ system or one area of the body. Whereas in plastic surgery, we get a lot of different field changes. We get to, work on the face. We get to work on the torso, the breast, the back, the legs, mm-hmm. Really wherever, to either do reconstruction or if it's for cosmetic purposes. Well, because of that, I thought that was a very, interesting and fulfilling, I guess you could say, type of practice. So I started to kind of focus my attention on how to get into plastic surgery, and I knew it was competitive, and so it's not only that you could have just like great scores or anything like that, but you also have to kind of set yourself apart as far as getting into plastic surgery training programs. And a lot of times they like to see that, you've done your, really kind of busy with research or, some other kind of endeavor within the plastic surgery field. I actually took a year off in between my third and fourth year of general surgery residency and pursued a research master's degree track.
Oh, wow.
And so in a year, I accomplished a master's degree at the University of Arizona. And it was in medical sciences, but my main focus was I was actually creating artificial engineered skin. And so what that gave me was a little bit more, in-depth knowledge about how the research process works, how to create something, how to undergo the different steps in order to, create or finish a project, and then have it get published and have it be peer evaluated by, other medical researchers in journals and things like that.
Sure.
And so that gave me a lot of insight on like how things come into, I guess, practice or into use as far as medical technology and things like that. And that gave me a lot of, respect for how we have certain devices that we use. It's not just that it just shows up on our doorstep and we're like, all right, we'll just start using it. There's a big process on how that occurs, and there's a lot of layers and steps for it to get approved and basically, safe for use, essentially, in medicine. And so not only did I, gain that respect, but I liked how it translated into what I was going to be doing for plastic surgery. And so after I finished that year, I obtained a master's degree. Then I finished out my fourth and fifth years of general surgery residency at the University of Arizona, and applied it during that period. And then I matched to the Mayo Clinic. That was in Phoenix, Arizona.
Oh, wow.
In Scottsdale.
Okay.
Yeah. So I did my plastic surgery training at Mayo Clinic in Phoenix and Scottsdale. Okay.
Amazing.
Yeah. And then, so that's a 3-year program, and we train in every aspect of plastic surgery, reconstructive, cosmetic, hand, craniofacial.
Okay.
Which is, I think a lot of people don't understand that in plastic surgery, we do not only, most people know about the cosmetic things about plastic surgery, maybe some of the reconstructive type work like cleft lips and things like that. But basically, anybody who goes through a plastic surgery training program is a fully trained hand surgeon as well. We do all the orthopedic hand type of procedures that any hand surgeon would do or that you would generally think about. That is a very sub-specialization of plastic surgery. And typically, if you want to practice in that, you have to get a secondary certification for that.
Okay.
But we're all trained in hand surgery. And that's a lot of times when we first start, we're doing a lot of hand surgery because that's what we can get business in the ER and stuff. But also with craniofacial, pediatric plastic surgery, the cleft lips, and then also with the reconstruction from like trauma reconstructions or cancer reconstructions, and then also cosmetics that everybody kind of knows about that because it's in the media a lot.
Right. We are speaking with Dr. Biswas with Marietta Plastic Surgery, and you're listening to Lenz on Business, presented by Lenz, Atlanta's marketing expert since 1992. Marketing matters, and Lenz knows marketing, from brand strategy to advertising, digital marketing to public relations. Think smart, think creative, think Lenz. Learn more at lenzmarketing.com. So you have been at Marietta Plastic Surgery for 10 months. What is your specialty, Dr. Biswas?
My main specialty that I probably have that I'll probably continue doing is essentially just cosmetic surgery, as well as also breast reconstruction. And so for the past, I've been in practice for probably about 10 years or so. And I just moved out here from Phoenix, Arizona. And the reason why is because my parents live out here and they're starting to need a little help and stuff. And so we wanted to be closer to family. But for the past, 8 of those years, I was pretty much doing all cosmetics and then breast reconstruction. And so the same dynamics of my practice, I'm basically moving out to here at Marietta Plastic Surgery. So I'm still doing breast reconstruction, so cancer-based reconstruction for the breast, but I'm also doing the full gamut of cosmetic surgery. I would say probably about 70 to 80% of what I really do mostly in cosmetics is body contouring. Okay, so tummy tucks, liposuction, breast, that probably dominates the majority of what I do as in cosmetic plastic surgery, but I still do like facelifts, eyelids, nose jobs, things like that. And historically, and also if you look at the trends, that's pretty much how most plastic surgeons, probably kind of break down their percentages into.
The body contouring makes such a huge difference in how you look. You can lose weight, but when you start doing the body contouring, it makes such a huge difference in how you look afterwards.
Absolutely. I think when you do body contouring, it can be one of those types of procedures that gives you a night and day difference.
Oh, absolutely.
A lot of the things that we do in plastic surgery is rather immediate, and depending on what kind of goals that you're looking for and the types of procedures that we use to kind of achieve these types of goals, you can have very immense, drastic changes in your body. If you're doing things like tummy tucks, with the addition of liposuction or something like that, it's very realistic that you can drop maybe 4 to 6, maybe even 8 sizes in
Are you
clothes
kidding
size.
me?
Dead serious.
Wow, that's incredible.
Yeah.
That's life-changing.
Life-changing, yeah.
Absolutely. And that's done with you, Dr. Biswas, and the other doctors
Correct.
at Marietta Plastic Surgery.
Absolutely.
All right. You're listening to Lenz on Business, and we are speaking with Dr. Biswas with Marietta Plastic Surgery. And later on in the show, we're going to talk about a type of liposuction that you are known for, and that's awake liposuction. So stay tuned for that. We're going to be speaking about that. So you talked about breast augmentation. So do you do a lot of breast augmentation and breast reconstruction from people who have had breast cancer?
Yes. So, breast reconstruction and then cosmetic breast are, I like to explain that they are 2 different animals.
Yes.
Okay. And the way that I kind of delineate the two is that when you do breast reconstruction, when you're using implants, I think what the patient needs to understand is that the breast implant, that when we use it in reconstruction, is your breast. Okay?
Okay.
Versus when you use a breast implant for a breast augmentation, that breast implant more or less is serving as kind of a pillow for your actual breast tissue to sit upon. And so you still have your normal anatomy when you have a breast augmentation, and you're just enhancing it, at least size-wise, and maybe shape to some degree, with that breast implant. But in breast reconstruction, that breast implant is serving as your breast.
Okay. What is the lifespan of a breast augmentation implant?
So, yeah, this is a very common question we get from patients, and I would always start with this is that, a breast implant is an engineered product. And so with an engineered product, there has to be some degree of a shelf life that's always attributed to a synthetic product, okay? And so the FDA recommends that the implant is replaced every 10 years.
Okay.
And so does that mean the implant is just not a good implant anymore or disintegrated or whatnot after 10 years? That doesn't necessarily mean that that's true. It is only a recommendation on the FDA because of a certain shelf life that they may have to, attribute to an implant. Most of the time, patients come in when they have a problem, but that could be 5 years from now, or it could be 30 years from now.
Okay.
It just depends.
Okay. Great information. Thank you so much, Dr. Biswas. We're going to take a break. We'll be back with more on Lenz on Business, only on 95.5 WSB. And welcome back to Business Talk on Lenz on Business, presented by Lenz, Atlanta's marketing expert since 1992. Our guest in the studio today is Dr. Biswas with Marietta Plastic Surgery. They have 2 locations in Marietta and Woodstock. Earlier in the last segment, Dr. Biswas, you talked about life-changing procedures, and that kind of stuck in my head. I mean, that's huge. What other life-changing procedures would you say that you perform at Marietta Plastic Surgery?
Yeah, I think that the life-changing procedures that we see, we mentioned about like a tummy tuck that can make you look completely in a much better, profile when you look at yourself in the mirror and in clothes. And I think there are several other procedures that kind of have the same dramatic kind of effect. Big one, I think, is actually breast reductions. Mm-hmm. Breast reductions, obviously opposite from a breast augmentation. Breast augmentations can still do the same thing, but I see breast reduction patients as some of the most happy patients after a breast reduction. And there's a couple of reasons why it's life-changing. And the reasons why is that it's life-changing is because a lot of times when you are carrying around large, heavy breasts, the weight of the breast, especially when it's falling below the level of your breast fold, now feels like dead weight, essentially, as far as how your body senses it. So the thing is that if you can take that weight off, where that dead weight sensation, and you can overall reduce the size of the breast, but also when you do that reduction, there's a lift involved in a breast reduction, which basically is taking that center of mass of the breast that's hanging off your fold and kind of placing it more and situating it on your chest wall so it doesn't feel heavy anymore. But not only are you achieving that center of mass where it's going to end up not feeling as heavy, but you're making the overall size of the breast smaller, so that way it's more manageable. So not only do you have a smaller breast, but it's also lifted at the same time. So now finding things like bras and being able to maybe participate in activities that before were not even even something that you can consider, now they're all on the table again. Right. And so I see with breast reductions, we get a great satisfaction scores from patients who have that type of procedure.
And the lack of back pain and things like that these ladies were experiencing is now probably gone. Absolutely. So, and a lot of the reasons why they come to us is basically for that reason, because they're carrying a lot of that weight in their shoulders and in their back, and it's causing abnormal posture, and it's causing a lot of muscle strain. And so a lot of times when you do this type of procedure, you can actually relieve a lot of these symptoms. Other thing that is nice about it is that when you do this type of procedure, it is almost looked as in a preventative medical way, in the fact that if you have bad posture from large, heavy breasts,
it can expose you to premature arthritis, disc herniation, and other muscle strains. And so if you can relieve that pressure or that feeling of weight in the front, and so that way they carry around better posture and better spine alignment, you can ward off a lot of those issues that may happen down the road.
Absolutely. And what is the recovery time from that procedure?
They're on their feet day one, so they should be able to use the restroom independently, make themselves some food if they'd like, and they can walk around the house and things like that. Generic restrictions after this type of procedure, and a lot of different types of procedures for that matter, is that you don't want them lifting or doing anything too strenuous for about 6 weeks, because that puts a lot of strain, especially on scars, for something like a breast reduction. And so that way we optimize their healing, because we're trying to protect the area of healing, but at the same time we want them to be somewhat active. So there's a fine balance there.
Thank you so much. And this show is also sponsored by PlumWorks. Are you looking for plumbers who are reliable, easy to work with, and always get the job done? Look no further than PlumWorks, Atlanta's premier family-owned and operated plumbing company with more than 30 years serving the Atlanta area. No matter the issue, big or small, PlumWorks can handle all your plumbing needs. So call 404-524-1825 or visit plumworksinc.com to schedule a service. We're going to take a break. We'll be back with Dr. Biswas and Marietta Plastic Surgery with Lenz on Business, only on 95.5 WSB. And welcome back to Business Talk on Lenz on Business with our guest, Marietta Plastic Surgery's own Dr. Biswas. And I want to remind you that the city of Brookhaven is one of Metro Atlanta's most vibrant and diverse communities. It's also a sponsor of Lenz on Business. Since becoming a municipality in 2012, it's made incredible strides in policing and public safety and infrastructure improvements while keeping its tax rate one of the lowest in DeKalb County. There's a lot of exciting things happening in Brookhaven this spring, including an ambitious 3-year road paving campaign, the opening of the Dresden District in time for Memorial Day, and the most recently requesting to run its own ambulance service to reduce EMS response times. Now, you can learn more about the exciting things happening with the city of Brookhaven by visiting brookhavengeorgia.gov. Now, remember, you're listening to Lenz on Business, presented by Lenz, Atlanta's marketing expert since 1992. Learn more at lenzmarketing.com. And back to Marietta Plastic Surgery's own Dr. Biswas. Dr. Biswas, I've been dying to ask you this question. Okay, so a little birdie told me that you're doing awake lipo.
Correct.
Okay, I want to know more. Spill
Sure.
it.
All right. So awake liposuction is a relatively newer technique. I mean, we've probably been doing it for now about about 5 to 8 years, somewhere around that range. And the way what it is basically is that you're just doing liposuction awake. Okay. Mm-hmm. So the patient is fully awake, aware. Yes, we are giving them the medications.
I was hoping.
Yes. They do get medications that make them feel into a very comfortable state. And then the way that it's done is when you do traditional liposuction, obviously when the patient's asleep, it's all the same steps essentially. The difference is that we use this solution. It's called a tumescent solution, which is essentially a fluid that carries lidocaine within it. And it's placed within saline, and so it's essentially dilute lidocaine, okay? And so we use a certain dosage when we're doing traditional liposuction that is relatively, let's say, conservative. It's a very mild dose, okay? Now, we can safely use heavier doses of that, to be honest with you, and that's how we are able to do awake liposuction. Because once we have the patient relatively comfortable off some oral medications that we give them, then we put in the same solution. We could put that tumescent solution of lidocaine, and it helps numb out all the different areas that you're going to be working on. And so what you do is after you put that solution in, we leave it in for probably about 10 to 15 minutes and let the patient just rest for a little bit. And then we can proceed with the liposuction. And so again, the patient is fully awake, and we're doing the liposuction. And as everybody has probably seen, if you looked on YouTube or TV, you've seen how liposuction's done. Sure, it looks a little,
aggressive,
and it's for all practical purposes, it can be because we're passing through the fat, we're trying to break through the fat, and we're sucking out at the same time. Okay. So a lot of patients have that concern. I was like, oh my God, am I going to feel, am I going to be in a lot of pain? Well, when we do awake liposuction, you should not be in a lot of pain. Are you going to feel something? Yeah, you're going to feel something, but it's tolerable.
Okay, tolerable.
Tolerable, right. And that's why awake liposuction has become a relatively popular thing, because some patients just don't like the fact of going under anesthesia. Right. Whether they have their own concerns about it, or if they have some fears about it, or maybe they're not a great medical candidate to undergo a general anesthetic. This is a great kind of alternative for patients who want to have liposuction done but may not want to undergo a general anesthetic.
What if you have a lot of lipo to be done? Are you still a candidate for awake lipo?
Absolutely. You can still do a reasonable amount of liposuction with awake liposuction. And the thing is that like most, states in general recommend that a max amount of fat to remove is around 5 liters, whether that's asleep or awake. Once in a while, we can push those limits.
5 liters. That's 2 2-liter Cokes and a half.
And a half, exactly.
Okay.
Yeah.
That's a lot.
It's a lot. Yeah, absolutely. And
it's a lot of fat.
Even on somebody who is carrying around a little bit more girth than others, it's still a big difference. If you're tackling a particular area, let's just say your midsection, your abdomen or trunk or something like that, you can make a huge difference just with that amount of 5 liters. And not only that, it can be done again. So that's the other thing. If if you stop at 5 liters, and that's kind of the recommended safe stop point. Right. Down the road, if you need to have it done again, you can't. Okay. So if you need extra amount taken off, that option is still there.
Because if you go more than 5, then your bodily fluids start to...
Right. So, you have to think about it like this. You have your body tissues and fluid that you have within you is, at a certain amount at any given time. When you take off that fluid, essentially what we're doing is we're dehydrating you. Okay, because we're taking away tissue, and that tissue carries fluid in it too. So we suck out whatever fat that we take out, and that is going to suck out some inherent water that's within that area. And so when we take out a large amount, let's just say we're pushing about that 5 liters or more, theoretically what you might feel is that you're going to feel really dehydrated. You may be feeling dizzy too. Okay. And that's what we don't want to have. We don't want you to, come out of the procedure feeling, all nauseous and dizzy and whatnot. Now, the thing is that while you're having this procedure done, we can also give you supplemental fluid. We can actually start an IV and give you an IV fluids.
To negate those feelings.
Correct. Right. And sometimes we do that, especially if patients have a pre-existing history of having like maybe some dizziness or nausea after having just regular procedures. Okay,
that's me.
Some patients do. Yeah, exactly. And some patients do. And if they tell us that they're that type, sometimes we'll preemptively do that. And I think that helps out a lot.
All right, let's talk cost.
Yes.
So you're saving on the anesthesia. Mm-hmm. So that's going to save you some money there.
Right. So typically whenever you go into a plastic surgery office and you're requesting a cosmetic procedure, there's typically 3 things that are factored into your quote. And that's number 1, there's a surgeon fee, there's a facility fee, and then there's a anesthesia fee. Okay. And that also includes a lot of whatever the consumables and materials that may be required. Okay. But a lot of times, certain quotes are based upon those 3 things and whatever the time it takes to do the procedure. Sure. Okay. With awake liposuction, what you're able to do is you're able to take away the anesthesia fee. Okay. Because you're not requiring an anesthesiologist.
You're still in the facility, in the operating room.
Right. And the overall time for the procedure may be somewhat truncated or roughly similar, just depending on what areas you're doing. So there are savings with that. So sometimes you can get a very decent, savings from the actual procedure because you get that extra fee that is not required from the anesthetics.
So you're saving money and you're saving being put to sleep.
Correct.
And what about recovery time? Because a lot of times that first day and a half, you feel so crummy from the anesthesia.
Right. So after, when you do it awake, because you don't have a general anesthetic, you don't have that fog necessarily that you may feel from having a general anesthetic. And so the ability for you to be more alert during your recovery period really enhances what your overall recovery and how you're going to feel will be like, because you're going to be more alert about things. You'll be able to listen to your body about things. And not only that, you're going to be able to get up on your own motivation much quicker.
Yes.
If you have a general fog from an anesthetic, you may feel like you want to lay in bed for longer than maybe what we would recommend, just because your body feels maybe still very relaxed, or you're just feeling very mentally foggy. Okay?
Right.
But because you know that you feel like, just like as you would from any other type of like day that you're waking up from sleep, maybe with the additional amount of soreness having a procedure, but because you are awake and alert, you know that, hey, I need to get up. I need to get my regular routine done. Let me get if I may need to help get the kids get ready or whatnot, or maybe you're getting ready for work, which we'll be able to do. You'll still be able to kind of get into those routines a lot quicker, and that greatly enhances your recovery.
Okay, so what is the recovery time? And you would still need to wear the compression garment.
Right. So everybody's got their own kind of protocols when it comes to liposuction, okay? And I'm going to explain mine.
Okay.
Because I think mine, I'd like to think that I look at it very rationally, and I'm going to try to convey the rationality behind it so it makes sense for the audience, okay? I usually tell patients that, when you're having any kind of liposuction, doesn't matter if it's awake or if it's asleep, okay? Or if you're having a tummy tuck and having liposuction with it. Regardless of the type of liposuction that you have, I recommend patients wearing a compression garment for about 6 weeks. Pretty much all the time.
Right.
Okay? I know that sounds like a lot, but once I kind of explain the rationale, I think it will help, okay? Make you understand why it's important. When you do liposuction, what's happening is that I'm passing a little wand back and forth within the fat layer, and ultimately what I'm doing is I'm sucking out fat, okay? Now, the thing is that fat is a layer of tissue, all right? So once I empty out fat, well, what do I have now? I have an empty area, okay? Well, anytime you have a procedure done, and liposuction's no different, you have to think of surgery or, cosmetic surgeries or really any kind of procedure. Anytime something happens to your body, just consider that, especially when it's surgery, this is called surgery, controlled injury, all right?
Okay.
And the reason why I say that is because your body could care less that surgery is happening or if it's a delicate procedure. It can't discern whether that's the case or if this is a car accident or if this is a little lump and bump or you stubbed your toe against the end table. All it knows something has happened, and what it will do is it will mount an inflammatory response. And that's going to manifest as swelling like we know it, right? Now, the interesting thing here, or the nuanced thing here, is that as you swell from a liposuction procedure, that swelling is fluid, and that fluid has to go somewhere. And that fluid will follow just like anywhere, just like a river or a lake. If there's a path of least resistance, that fluid will typically want to flow towards the path of least resistance. Well, guess what? In liposuction, I've created a big path of least resistance by emptying out a whole layer of fat. And now the fluid wants to go into that space. Now, if I just left that as is and I didn't provide any compression, then if you left the office with no compression, that fluid is just going to start to dump into that space. And basically, you separate the tissues out and keep them apart from each other, and you may not notice any results at all. So the purpose of the garment is to basically squash down that layer of empty area that I've just created, so that way the tissues are held together in a slimmer position, and we allow for the garment to keep it like that, almost like a splint, so that way as scar tissue is holding or forming, it holds everything in place and cements it in that slimmer position.
Makes total sense. Makes total sense. Okay. Well, folks, I want to remind you that Lenz on Business is presented by Lenz, Atlanta's marketing expert since 1992. Marketing matters, and Lenz knows marketing. From brand strategy to advertising, digital marketing to public relations. Think smart, think creative, think Lenz. Learn more at lenzmarketing.com. We're going to take our final break and be back with our final segment of Lenz on Business with Dr. Biswas from Marietta Plastic Surgery. You're listening to Lenz on Business only on 95.5 WSB. And welcome back to Business Talk on Lenz on Business, presented by Lenz, Atlanta's marketing expert since 1992. Our guest in the studio is Dr. Biswas with Marietta Plastic Surgery. Thank you so much for spending this time with us today, Dr. Biswas.
Thank you for having me. I really appreciate it.
Absolutely. So this season that we're in is kind of surgical season.
Yeah, absolutely. Usually the time after summer is plastic surgery season. I mean, because the thing is, as the weather gets cooler, you're going to be wearing more clothes. So as you're recovering from certain procedures, it's easier just to hide. So that way, if you're wanting to recover and not be, like too much in the public's eye, and you want to be a little bit more discreet about it, it's perfectly fine to be having a surgery where you can actually kind of cover up a little bit more. Not only that, if you're getting ready for spring, summertime weathers, and you're thinking about it, maybe a particular vacation, or if there's going to be beach time or something like that, and you're really want to try to improve maybe your profile and how you appear in shorter clothes, maybe this is the time to have the surgery done because it gives you ample time to recover from these types of procedures.
Absolutely. So let's go over the procedures that you perform, Dr. Biswas.
Yes. So I think, like I said, a lot of what I do is body contouring, so that really involves like abdominoplasties or tummy tucks, with or without liposuction, awake liposuction by itself, and things like arm lifts, thigh lifts, and then all the full gamut of breast surgery. So breast augmentations, breast reductions, breast lifts, even implant removal. For some patients, the implants just aren't, providing the effect that they originally had them intended for. Maybe we just due to like aging, having some kids, and maybe just skin, I call it Mother Nature things.
Yeah.
As Mother Nature, who, again, does not play well with us, and that's what our whole job is try to ward off whatever Mother Nature tries to throw at us. The thing is that certain things, like such as breast implants, may not, provide their same role. And so removing them for that particular reason is a perfectly fine thing to do, okay? But I also do a lot of facial type of procedures. That includes facelifts, rhinoplasties, which are nose jobs, eyelid lifts, upper and lower eyelids. And sometimes I do even on like kids or young adults, areas where they want to have their ears pinned back. We call that an otoplasty.
Okay.
We also do the full, gamut of using fillers, Botox, things like that. So those are non-surgical types of means for, beauty enhancements.
Great.
Helping with like, fine wrinkles and things like that. Laser surgeries, to help with like resurfacing the skin textures. We have a full esthetician unit at our office too.
Well, I know our listeners want to get in touch with you. How would you like them to do so and make an appointment?
Yeah, so, we're at Marietta Plastic Surgery, and so our website has our contact information.
Okay, it's mariettaplasticsurgery.com.
Yeah, so mariettaplasticsurgery.com, which has our contact information. You can even schedule online, or just in-person, phone calls and maybe even walk-in consults.
Excellent. Thank you so much for joining us, Dr. Biswas. I want to remind you that Lenz on Business is produced by Lenz, Atlanta's marketing expert since 1992. Marketing matters, and Lenz knows marketing from brand strategy to advertising, digital marketing to public relations. Think smart, think creative, think Lenz. Learn more at lenzmarketing.com. Make sure you check out our website library of past shows at lenzonbusiness.com. That's LENZ on business.com. Thanks for listening, folks. You're listening to Lenz on Marketing on 95.5 WSB.